Several foreign governments are also deploying medical teams to help the victims of the typhoon. They include doctors, nurses, and support staff. This report.
In its hour of need, the Philippines is not short of friends. There has been an overwhelming support for the government's massive relief effort to relieve the suffering of struggling survivors from Typhoon Yolanda's impact. Health has the support of the World Health Organization plus 10 nations, which deployed medical teams numbering 500, composed of doctors, nurses, and support staff. It was the turn of Japan to help after the Philippines extended its hand of support for tsunami victims in 2011. It's a 25-man team assigned for 2 weeks. They brought supplies and medical equipment. The United States, Great Britain, Germany, Belgium, Russia, Israel, Australia, Malaysia also deployed their medical teams. More have expressed their commitment to help.
Who are now here in the Philippines to help and support across all of the areas that have been impacted by the typhoon. The support is to the DOH in a number of different ways. One, there are quite a number of supplies that WHO has procured and brought into country. These are essential medicines, essential trauma kits, essential things for the wound care and for the prevention of disease that the Secretary of Health was talking about. Secondly, we're helping to coordinate all of the international support. There's been an outpouring of international support in the Philippines and an enormous display of solidarity from the international community to the people of the Philippines.
Dr. Julie Lynn Hall, the World Health Organization's representative in Manila, said all these teams were deployed to the disaster areas. Their concern is to prevent the outbreak of any disease, keep the victims healthy, especially the children who are vulnerable to getting sick. Hall assured there is sufficient supply of medicine, shelter for those rendered homeless, and clean water to drink and food which will protect our suffering people.
Shelter, food and water still remain high priorities for many people in the affected areas. That relief is coming in. All of those supplies are available here in the Philippines now. It's a matter of getting those access routes open and get to people. People do need clean water. The risk obviously of diarrheal illness from contaminated water or from food that is not prepared properly. Clearly that risk is there, and the sooner the people can get clean water and safer food to eat, the lower that risk will be.
In the meantime, 20,000 body bags are due to arrive, which may be used for bodies recovered from the disaster. To date, the health organization has provided initially 1,000. For the People's Television Network, this is Freddie Abando reporting.